need to worry about her sleeping? Like you said, sometimes they sleep at weird times, so not going. And when they're sleeping, do I need to like check on her to make sure she's still kind of okay there? Or
so there used to be a recommendation of waking kids to make sure that they're okay.
Oh, the worst. Okay, that's what it's got. Okay,
in general
like
now.
From somewhere.
So it used to be recommended that you wake children through the night, but in general, now really we know that the brain needs rest in order to recover, and so we really recommend if, especially in those first few days, if the child wants to sleep, that you let them sleep and that you don't interrupt their sleep. And again, often they want to sleep during the day and then sometimes have difficulty sleeping at night. So that's something that we kind of watch over time.
Is it okay to let them do that? Just kind of follow their sleep schedule? Or
for the
make them keep them up and like you come from Europe and you try to stay up? Right. Or is it okay if they're sleepy, let them sleep?
For the first few days, you want to just let them sleep and let them recover the way they need to recover. But after that, it's important to start trying to get back into a routine. Because that routine will likely help them recover.
What is the best way for me to talk to the coach without kind of stepping on his toes? Because you kind of saying you want the child to go back just to kind of get back to the routine. But on my end, I'm like, I don't want her to like go full force, but she's a child. Right. She doesn't know any better. So what is the balancing act there?
So most coaches now have to have some concussion training.
Oh, okay.
So they should have some sense of what it is and sort of what we're dealing with. But there is a very clear, on the CDC website, there's a return to play protocol.
Okay.
And basically, it's nice if there's a coach or a trainer that can help the child through it. And if not, then you can.
Okay.
It's pretty straightforward. And if you at any point feel like the coach isn't following it, then that's a time where you would want to step in. Or if you feel like the coach doesn't understand it or won't adhere to it, then you definitely want to step in. But again, I think most coaches now are pretty aware of the importance of managing concussion in a safe way, especially in young kids. So basically, the return to play allows for initially doing nothing. And then if you don't have symptoms, typically you want kids not to have symptoms before you move into it. And again, if they have sort of a little bit of symptoms or overall getting better, and we're getting to the point of, are these symptoms because of the concussion or because they're pulled out of what they enjoy?
Right.
Then my feeling is you sort of move forward, and if things get better, then we're in a good spot. It's probably not concussion related. We're probably recovering from the concussion. But if things get worse, then again, we take a step back for at least 24 hours.
Okay.
And so with the return to play, there's step 0 is basically doing nothing, and then you move into just a little bit of walking. So that's sort of getting your heart rate up a little bit, moving your body a little bit. And each step should take at least 24 hours. If after 24 hours they're fine with that, then you move on to the next, which is doing a little bit of running, a little bit more head movement, heart rate up a little bit more.
Right.
If they're good there, then the next step is to do drills. So the point of the drills is, again, to get them moving, to see how well they're coordinated. So that can also, with concussion, you can have decreased coordination, maybe not thinking as clearly, not having as quick of reflexes. And so drills, again, they shouldn't be at risk for getting a head injury, again.
Ideally,
but it's somebody watching to make sure that they're playing the way that they usually play. And again, when they're doing a little bit more exercise, that it's not leading to symptoms. And then the next 24 hours, they can actually return to a practice. And again, that is the coach looking at them or somebody who's used to watching them play to make sure they really are playing the way that they usually play. And then on day 5, they can actually return to games, as long as they, with each of those, kind of pass the mark. They are doing what they're supposed to do and they're not having symptoms. And again, if at any point Alexis develops symptoms, then you would take it a step back for at least 24 hours. But the idea is now to sort of continue to try to move forward. And if for some reason we're not able to move forward, then we kind of readdress things, make sure we're not, that there's not something else going on that might lead to more prolonged symptoms or if there's a reason that it's harder for her to move through the return to play. So technically a return to play can actually happen within 5 days. But sometimes we take a little bit longer with each step, depending on the child.
Is it the same approach I would do in the school nurse? Is the school nurse kind of my child's advocate within the school setting, just because it's kind of up her alley? Or, and it would be the same, because you mentioned the whole partial phase in and then sleep within the nurses. Like, is that like they know that this is how you should do that?
So most of the schools have some sense of how to manage concussions. Some of them seem to work a little easier with families than others. And again, some schools have trainers, some don't. Some schools have a nurse who kind of knows more about concussion, and every teacher.
Do you write a note or something with actual guidelines and it says like a medical note? I think that might be the best.
Yeah, so I think most providers who do concussion actually have an accommodations form. And actually some of the schools even have a specific
form. There is such a
thing
as accommodations form? Mm-hmm. Oh,
yeah, good. So it writes specifically what accommodations you want in the classroom setting.
Okay.
And then also specifically what accommodations you want for physical activity. Yeah, and then I usually see people back about every week or two to make changes to that accommodation form as needed.